patient. Now, I this is just my own brief introduction about what on introduction to clinical bioinformatics. The next thing we'll be doing now is that we want to walk us through different pipelines. Yeah, so I want us to walk through different pipelines and what they are actually used for. I have what are the pipelines that we use in clinical setting, that bioinformatics, and the pipeline that are used for. Let me just share this. I have a study we are trying to look into for those who studied nutritional dietitian. Diabetics, you go to nutritional dietitian and they gave him or her the kind of food. There's a table you eat in the morning, you eat in the afternoon. We are working on something we call nutrigenomics. So nutrigenomics allow you to actually ascertain at that diabetes level of that individual what are the kind of food that will enhance in correcting the state of disease of that individual, so that you are not giving such an individual a generalized food. So that is what the omics is always talking to us about. Now, the few things I've rightly said now, before we move on to the pipeline, where Daniel will be coming in, what they are used for, how it can be used. This call is just an introductory class, just to familiarize ourselves what is coming up. Detailed workshop that will be taking exam breast of actually what is going of a clinical setting, and that is why this I want us to take comments and class references after Daniel has taken his class before I come up again for another discourse. So I think, Daniel, you are ready?
Hello, good morning, everyone, and good afternoon for those that are joining from, maybe they are not from Nigeria. So I believe you can hear me very, very clearly. Okay, all right. So let me start by sharing my screen. So we've gone through the basics of maybe the clinical bioinformatics, what clinical bioinformatics is all about. So now we want to check some databases that a clinical bioinformatician can use to carry out some research. So I'll start by sharing my screen. So I believe you can see my screen. So if you can see my screen, I need a thumbs up. So today we'll be discussing about clinical bioinformatics databases. So how to bridge the gap between genomics and healthcare. So I'm Daniel Adetiran. It's a pleasure being here. So I'm a trainer at Ellis Biogen Institute. So what are the significance of clinical bioinformatics database? We have a lot of database out there. So how can we try to make some inference from clinical reference from all of these database? The first thing is that it enhances data interpretations. A lot of databases are organized they are very organized to in they are very organized and we can make some insights on a particular disease from some of these database, and we can make a personalized medicine. We can tailor some of information from this database to provide a kind of treatment for a maybe a particular patient, to make some inference for what have been reported about this disease condition from the databases. And so how clinical bioinformatics database can benefit both healthcare and research? How can we try to make use of some of these database in the clinic, and both in the research aspect? So in the research aspect, researcher can access and analyze a vast pool of genomic data. So this would surely accelerate discoveries. Yeah, maybe we have a lot of data sets that we want to analyze, so we can just go into the database to compare our result with what is already existence in the databases. So another thing is to improve diagnostics. So clinician can make informed decision based on genetic information, trying to optimize treatment outcome based on the genetic information that we have about maybe the particular patient. Let's say we are discussing about a breast cancer patient, and from our genomic analysis, we'll be able to show that it's BRCA1 that is kind of implicated in this patient. So trying to go into the database, you can make some inference and clinical decisions about what could be wrong with the patient, and how can we kind of provide treatment for that kind of patient. So also it helps in drug development. So after making some inference uh, from this patient, you can tailor the kind of therapy that will work for this kind of patient. You're looking at database, what kind of drugs will not work for this particular patient based on the kind of variant that patient is expressing. So these are how to make use of clinical bioinformatics databases, and we have a lot of uh, these databases, some that we are familiar with and some that we don't really know that we can make some clinical decision from. So I'll just move straight into the hands-on sections. Here we are not discussing about how to make a mechanism works, but what we want to do is in silico approach, how to make use of our system to make some clinical decisions about maybe a patient from our database, our bioinformatics databases. So beforehand, some of these approach that I'll be showing us, I would like to say that it's not the best approach to follow while trying to make some clinical decision. You need to consult your physicians before maybe you can propose something like this to your physician, but you need to consult. This should not be the best practice that you can use on your own. You need to consult physicians for that. So this is just my disclaimer before starting with the hands-on section. So the fourth database that we'll be looking at is clinical variant. Clinical variant is a database that is hosted in NCBI. NCBI is a public database. NCBI is a website that hosts a lot of public database. So one of the database is clinical variant database. So from clinical variant database, we can make some inference about a particular patient. The first one I'll be discussing here is we have a patient information. The name is Sarah and the age is 35. So a family history about this patient is that our maternal auntie was diagnosed with breast cancer at 42. Our maternal grandmother was diagnosed with ovarian cancer at 50. So, and this kind of patient is kind of doubting if she is not predisposed to either breast cancer or ovarian cancer. So she decided to she decided to sort out for genetic counseling about her genetics mix of if she's going to be predisposed to breast cancer or ovarian cancer. So she was concerned about her own risk and wanted guidance regarding her screening and how the preventive option that she can use. So the next step is to take a sample, then do sequencing, carry out genomics analysis. There a lot of genomic analysis, variant calling, which is one of the things we are presently doing in our virtual internship, trying to do variant calling. And from your variant coding analysis, this one of the results you are going to get is a variant ID. Either there is a kind of insertion, there is a kind of deletion, structural variation, and other kind of variant type. So from Sarah variant analysis, the genetic testing revealed a variant in the BRCA2 gene. So at position 5796 and 5797, there's a deletion in cytosine molecule there. So there's a kind of deletion from that position. And again, this involves a lot of analysis before getting to this particular stage. So you sequence, send the patient sample for sequencing, then you do a lot of bioinformatics analysis before arriving at this point of getting the variant ID. So now we have the variant ID. I'll just move directly to my web browser. Then I can either do MTBI. You can type MTBI on your web browser. So I'll click on NCBI and I would so this is NCBI web page. You can see that NCBI hosts a lot of websites, a lot of database rather. So we have a lot of database, but what we are interested in is the clinical variant database. So now I already know that this is what like the kind of variant ID from this patient. So what I'll just do is pick this up, this variant ID, then I will insert it into this page. So this is a variant ID. And before then, let me try to click and show you something. So this variant ID, sometimes you don't need to come to NCBI, you can just go directly, then click on clinical variant. So and it's going to direct you to clinical variant database. So as you can see from here that it's showing you the kind of ID that you can provide to this database. So you can provide gene symbol, you can provide uh, the location of that mutations. You can provide the AGVS expression. That's the kind of consortium ID. So the C dot, P dot, conditions, and some other informations like that. But what I just want to provide to this database now is just the location and the kind of mutation that is occurring there. So which is a deletion. So I'll just provide the ID and I'll click search. So you can see from here that you have information about this. Maybe it's a clinician that is using genomic testing. He or she doesn't know the approach to go about it, how to know if the Sarah is predisposed to breast cancer or ovarian cancer. But via inserting the IDA, so the clinician can check that this Sarah may be disposed to breast cancer or ovarian cancer. And this kind of variant has been reviewed by experts panel. A lot of experts have worked on this particular variant, changing the deletion in at position 5796 and 5797. So that's going to cause a mutations in this, and this is just like the kind of this ID, the BRCA2 ID here is the same thing at this position as well. So let's just check on this. You can see that this is BRCA2 gene, and the condition is breast ovarian cancer. It's a familiar one, that means it's hereditary. So Sarah may be predisposed to this later in the future, and this kind of variant is very pathogenic, as reported by this, like the first one, like the very particular one that we are trying to look at. But this one is very related to this, and that's why we are seeing the output as well here. So this is very related and can also cause the same similar conditions, and it is likely benign. That means she's still predisposed to this, so we cannot rule it out that she's not predisposed to either breast cancer or ovarian cancer. So what I'll just do is I'll click on this, and we can see a lot of informations about this particular variant. So you can see that it's pathogenic, right? A lot of idea has been assigned to this based on different consortium that are trying to work to validate that this is truly going to predispose somebody to breast cancer or ovarian cancer, or this may cause breast cancer or ovarian cancer. And you can see that it's a deletion, it's a two base pair deletions. The kind of mutation, the molecular sequence is frame shift mutation, right? From our basic molecular biology. So these are some of the information that we can just look at, and we can just go down. Yes, these are just submitted interpretations and evidence about this variant. So a lot of consortiums are trying to work to validate most of these variants, and one of the consortium is Enigma. Enigma is the consortium. You can see LabCorp, different consortium. They are trying to work to review this variant. Is it truly causing breast cancer or ovarian cancer? So we have a lot of, and we can see that most of these consortium are reporting that this mutation, this two base pair deletion is pathogenic. This one is pathogenic based on this enigma, and the condition is breast ovarian familial, so, something like that. So and this is submitted by enigma, as I said. So this is the comment of this particular consortium. So the variant early predicted to encode a truncated non-functional BRCA2 gene. So the BRCA2, I think the BRCA2 is a DNA repair enzyme. So it's going to lead to a non-functional protein. It's going to lead to a non-functional protein, and so this is the Enigma report. So you can see some other consortium report as well, LabCorp. So their own information about that. So everything is boiling down to the same thing, that this is going to predispose a patient to either breast cancer or ovarian cancer. So this is a lot of information. It's pathogenic. So it's pathogenic. Everything is pathogenic. You can see that they are all reporting that it's pathogenic, and some has been reviewed by experts. This has surely been reviewed by experts. So this is how to like check if you're either a clinician or a clinical bioinformatician working in a clinic. This is how to just check that this variant can predispose uh, a patient to a particular disease. And another thing is that, from here I show us just a single variant ID, right? So we have just a single variant ID. So in a real clinic case scenario, you won't have something like this. You will have maybe a lot of hundreds of ID. So trying to gather all this ID together and make some clinical decisions may take maybe a lot of still ID. So this is one information. What you can do is just download this one. So you are going to download this one, then the other idea as well. So there's a way that you can do it, maybe using the NCBI API or something like that. But what you can do is just download this one. So you do the same thing for other ID, download it as well. Do the same for every variant ID that you found to be unique to this patient. So you download everything, and you can just make a clinical decision about it, that all this information are pointing to the same direction. They are saying that this is going to predispose the patient to a particular disease or not, based on the different variant ID. So, and that's how to go about that using clinical variant database just to confirm, just to make some clinical decision about the variant ID. Is it is posing a patient to a disease or not? So another database that I want to into, and before going further, so this is kind of a preventive medicine. Sarah has already know that there is possibility that she's predisposed to either breast cancer or ovarian cancer. So she can now like consult clinicians about the kind of drug that will be that will work for her case, and something that can and some preventive measures that she can put in place, like not to like maybe some environmental factors may kind of speed the process of breast or ovarian cancer development. So she can make some she can request for a kind of preventive measures that she needs to take put into consideration so that she is not going to develop breast or ovarian cancer at the end of the day. So, and another database that I want to show us is the pharmacogenomics database. So the pharmacogenomics database. So this is another case scenario, but this can continue from the aspect of Sarah as well. Maybe she already identified the variant ID, so she can insert it into pharmacogenomics just to be sure that this this particular variant, this is the kind of drug that this patient should be using, not this one, and some other information like that. Though all these things are still work in progress. Sometimes she may have a variant ID, insert it into the database, and it's not going to work at the end of the day. So this is another case scenario. It's trying to optimize our medication with pharmacogenomics knowledge base. That's pharmacogenomics knowledge base. That's pharma GKB. So we have the patient information here to be John. His age is 65, and he has a medical history to be a type 2 diabetic patient and hypertensive patient. So, and like I said, John is 65, and he was presented with uncontrolled blood pressure despite multiple anti-hypertensive medication, and his physician suspected possible maybe pharmacogenetic factor influencing his response to medication. But just to be sure that this is truly maybe a kind of variant in John genetic makeup that is making it him to be kind of like the antihypertensive drug is not working for him. So it may be some a kind of variant in his genetic makeup. So while trying to do genome analysis and genetic testing, the physician was able to find that CYP2D6 gene. CYP2D6 gene is it is cytochrome enzymes that would tends to activate uh, the drug, the antihypertensive drug. Some of these are antihypertensive drug that John is taking. So his physician found out that there's a variant in John CYP2D6. So one of the things that we can just do is that just go into the pharmacogenomic KB, pharma GKB. So this pharma GKB. So for the case of, you can see from pharma GKB, you can insert either molecule ID, you can insert the gene, you can insert variant as well, just to be sure of the just to be sure of the kind of drugs that this particular patient is going to use, the kind of drugs that will work effectively for this patient. So you can also insert variant ID, but again, this is a work in progress. Sometimes let me just try to insert this. So it's not going to show some information. If I should insert this variant ID on Sarah, sometimes it's not going to bring out information because this is a work in progress. But this is assigning like ID. This RS is a DB sleep ID. Let's just go into that and look at what. So this is not associated with the gene that we are working with. This is associated with another gene. So it's, but this is a work in progress. That's to show that the pharmaco KB project is a work in progress. They are still trying to collate some information to kind of make some clinical decision if this is going to work. But what I just want to do here is I want to insert CYP 2D6. CYP 2D6. You can type it anyway. So I'm inserting CYP 2D6 into pharmacology. You can see here that there's a lot of clinical annotations from here. So there's a lot. There's a kind of tier one, a kind of annotation tier one, tier two, and tier three like that. Just trying to in fact that this has been this is in clinical setting now. Like the tier one means maybe clinical setting, maybe tier three like that in research or something like that. So this is just showing us that there's a lot of information about CYP 2D6 gene. So what I can just do is I want to check the clinical annotations about these informations, some informations about uh, the CYP2 disease. And again, the CYP2 disease that I'm showing us here is I'm not specifying a particular variant. So there is different variant of CYP2 disease based on the genetic makeup. So maybe there's a kind of mutation at this point, or there is kind of maybe insertion, deletion at one point or the other. So there is a lot of variants in this CYP2 disease. Let me just come down here. You can see here that we have level 1A. This is just showing the level of confidence that we are sure that this is what this variant are like, the kind of association between these variants. And you can see from here that let's just check the first one, level 1 variant. I can see the kind of drug paroxetine. What's the action of this gene? It's a metabolic enzyme. And is there any phenotype that has been reported about this? Nothing has been reported about this, right? So we can still go down to just look. The patient in question now is an hypertensive a diabetic type 2 diabetics patient. So we can just go down to just look at the phenotype. Is it related to what we are trying to look for? We can check it here that heart failure. Let's look if there is hypertensive patient, some other informations like that about this patient. So there's a lot of informations on this. So you can also filter as well. So there's a lot of information on this. We can see from here there's maybe uh, hypertension, right? And these are the variants associated with that's been reported about CYP2 disease. It's a level 1 confidence. So these are a lot of variants. And again, this the particular variant that we would like to check for, we should have that from our genomic analysis. That means we already carried out some work from this patient. We identified that maybe it's CYP2 disease one. It may not be like it's not going to be general that it's going to be CYP2 disease. So it's going to specify the kind of variant that the kind of mutation in the CYP2 disease, either it's CYP2 disease one or some other informations like that. So and since I already find out that this is hypertension, right? So I want to check the details information about this. So there's a lot to learn from pharmacogenomic knowledge base. So there's a lot. So I want to check some information about this. This is just some information about this particular gene. So I can just go to it to check if we are talking about CYP2D617. How is this associated with hypertension and what kind of drugs can be used? So these are a lot of information that we can always check from. So, what kind of clinical decisions can we make from here from the database? So, and another thing that we can do is let's go back. So we can see that CYP2 disease. So this is it. So we can check the drug. How is the drug associated with this? So this is a drug, and the drug has been associated with maybe a variant in CYP2 disease. So this is just a way to check if this drug is going to work for the hypertensive patient, or if it's not going to work based on the chemical structure. Sometimes this thing depends on some other research, some downstream work you need to do to confirm that if this hypertensive drug is going to work for this patient or not. So I have a question for us before we go further. So I want us to go into pharmacogenomic knowledge base. I believe you can still see my screen clearly. I want us to go into pharmacogenomic knowledge base. So, and I want to just read the information about this patient to us, so we can go into genomic knowledge base to draw some clinical inference from this. And again, what I'm showing us is not like you need to go in depth into the database to look at what some kind of clinical decisions that you can make from this database. You don't like how I check. You don't need to check randomly. You need to read it in depth to know the kind of clinical decision that you can make from this database. Something that you can always learn from. So, and the information that we have from here is a patient named Maria. So, her age is 42. She was recently diagnosed with HIV, and she experienced a severe hypersensitivity reaction to Abacavir. So, and like I said, she suffered from a severe hypersensitivity reaction. So after taking this HIV drug, so uh, our clinician decide to look at our genomic makeup to know what could cause this hypersensitivity reactions. So what I just want us to do is you go into pharmacogenomic knowledge base to and type Abacavir if you are going to see any information about Abacavir on a pharmacogenomic knowledge database. I believe we all get my questions. So, so if we get my question, I want to see our thumbs up. I, we need to go into pharmacogenomic knowledge base. Then you type Abacavir and look at some kind of clinical maybe decisions that you can make from this kind of patients suffering from hypersensitivity reactions. So if you have any question, you can drop it in the chat box. So I need a response very soon. So you can type it in the chat box if you have the answer. You can type it in the chat box. I need a response about that. So what I said we should check for is we said this patient. Let me go back to the slide. She's diagnosed with HIV. So, and one drug that you can use for HIV patient is Abacavir, right? So now, and she's now showing some sign of maybe hypersensitivity reaction after taking Abacavir. So, our clinician decide to sequence her genome to check to screen to what could be wrong. Why is she kind of allergic to Abacavir? So, and after sequencing, the clinician did some genomic analysis variant calling, identify kind of patterns from this patient. So the clinician is now faced with the problem of trying to interpret the output of the variant analysis. So the next thing for that clinician to do is to go into some of these clinical bioinformatics database to kind of make some decision of what could be wrong with this patient. Why is she being like kind of allergic, showing a kind of inflammatory response to Abacavir. So and I said we should go into pharmaco. I'm going to put the link to that database into the chat box. So you can the database is open access. So you can just go into the database and uh, just type. I already insert the link to our chat box. You can just type pharmaco GKB. So GKB farm GKB. So just type it, and from there, how we did this, what we did from here is I just type you just type the name, or maybe it's Abacavir that you want to type, and you want to see what has been reported about Abacavir, right? So you just type it into Abacavir, and you just type into the database. You type Abacavir there, and you screen some information from there to check if there's an association between Abacavir and the kind of data type from the patient. So that's what we want to check. So I can see from some response from here. So Gloria Adioje said, uh, uh, 5701 present more Alice information. Patient with one or two copies of HLA-B 5701 has an increased risk of hypersensitivity to Abacavir as compared to patients with no HLA-B cell, right? So is there another response from this? So and I can see a lot of responses with HLA-B 5701. So we can see a lot of response from here. So we are all right. So it's HLA-B 5701. So it's a particular type of HLA. So HLA are going to kind of maybe bind to these drugs and induce immune response. So that means Abacavir should not be used for this kind of patient because she's expressing HLA B5701, right? So this kind of drug should not be used for that patient because she's allergic to Abacavir due to ability to express this particular HLA B5701. HLA B5701 it's an MSc class one, one of Alice from MSc class one. So she's expressing HLA B5701, and that B5701 will be able to kind of bind to Abacavir, and that will surely induce inflammatory reactions. So this is how to just make some kind of decision from this kind of patient. I can see a question from uh, I can see a lot of questions. How can we get to download it? I show us clinical variant database. You can download it from there. So if you have a lot of information and you want to download, you can always download from there. But in most case scenario, as clinician, just want to check too if if there is an association between some of these things. You just want to check through the database, but you can also download from there as well. You can do a lot of things from there. You can, but most of the time you can see the button here. Just download it as Excel sheet. So you then make some analysis from there on, depending on what you are trying to do. So you can download from all of these database, but a clinician trying to make a decision, a quick decision, so that clinician is going to go into the database, then just check through the database like that without the need for download. And again, this depends on the setting, the clinical setting. Maybe there's a translation, a clinical bioinformatician there. So that kind of clinical bioinformatician needs to download the informations and make a clinical decision from these databases. So that's that's the job of a clinical bioinformatician. And again, there could be a clinical bioinformatician on seat, some genomic analysis on seat. So the genomic analysis, what the genomic analyst is just going to do is do maybe variant calling, variant annotation, and some other downstream analysis before pointing out that it's CYP2 disease, or it's a kind of deletion from this patient genome. So then the genome analyst is going to pass maybe the results from there to maybe a clinical bioinformatician. So and the clinical bioinformatician is just going to make some decision that would help maybe the physician or the clinician to make some to kind of note the drugs, or how to kind of tailor a drug for this particular patient. So I believe we got that. So HLA, another is HLA. So you are right. You are all right. Can the clinical bioinformatics database applicable for some diseases that is not heredity? I mean to take decision on the patient data that is not heredity. So this is genomics, and we have an aspect that is epigenetics, that you can always try to look. Maybe there is an environmental factor that is contributing to this. So and these environmental factors, so you can this is going to like kind of change the genetic makeup of that individual. So it's that genetic makeup that you are going to do. But I think there's a project going on that is related to trying to identify some mutational signature. So maybe if a person is maybe a smoke patient, is sure going to predispose that person to lung cancer. Maybe the smoke is kind of causing a kind of mutational signature in the genetic makeup. It's the genetic makeup that you are going to still look at, but you just need to kind of do a reverse mutational signature to look if this mutation is as a result of maybe the best is this environmental factor that is causing it. So and again, this is like a multiple process. You can always do a lot of research with this clinical bioinformatics database depending on your knowledge of your understanding. So somebody said HLA-DQB1 is associated with increased risk of when treated with Abacavir people with HIV infection. And again, this is why trying to check through the database. You are not just seeing HLA-B57, you are seeing HLA-DQB1 from the database. So this let's now say that this is one aspect that you are seeing. You are not seeing the other aspect. You cannot rule it out that this is not contributing to this to hypersensitivity reaction. It could be HLA-DQB1, it could be HLA-B57. So getting all of this information into one place would surely validate that this is what is causing this hypersensitivity reaction. So it could be HLA-B57 and some other HLA that is predisposing, uh, uh, that is causing the hypersensitivity reactions. So I can see a lot of response from here. So we have a lot of response from here. Please can sure we are going to have the recording at the end of the class today. So I can see another question here that HLA is only identified pharmacogenomics that is consistently associated with clinical diagnosis of ABC, HSR reactions. How some patients with a suspected ABC hypersensitivity reaction may not have. So I think it's a kind of comment from Sharon. The data collection, does it has age range or no age limits for collection? I'm not getting your question. Are they doing? So this is just general checking. So there may be some times that you need to just look at maybe the age aspect from the patient as well, if this could be a contributing factors. So if I'm able to kind of answer your question a bit. So how about if there's a drug-drug interaction, assuming Abacavir is administered alongside another uh, drugs, let's say atin. So I don't know the function about all other drugs, but I just know that uh, we are looking at it that maybe it's Abacavir that is maybe Abacavir and atenolol that is kind of causing this hypersensitivity. It could be that. So what you just need to do is type the name of this another drug as well, or maybe there's a kind of association. There's an aspect called maybe a kind of maybe molecular dynamics or like that. You want to look at the association if this is a kind of association between these drugs. Is this one activating the other, or some other informations like that? So, and it involves a lot of thorough check. Maybe there's an association between these conditions and others. So, but depending on what you are trying to do, so maybe the patient is administered both, and it may not be Abacavir. Sometimes maybe and there's an information about this. You can just go to the database to just make some clinical decision on this. So so if some patient with that respond that are hypersensitive to Abacavir, they may not have HLA-B57. It may be due to some other conditions as well. So we cannot, while trying to make clinical decision, we should not expect to like cover everything at once. It may be some other things, but just trying to make quick clinical decisions sometimes. And you can see that it's HLA-B57. So we can just with that it's like that is a result of expression of HLA-B50 B5701 that is predisposing that to that patient to maybe a hypersensitivity reaction to Abacavir. But if that is not expressed, you can also look at while trying to do genome analysis. You are not getting only HLA-B57 doing genotype. You are not getting HLA-B57. You are also getting some other informations like that that you can use to make clinical decisions. So it's not just one thing that you are working on. You are working with a lot of informations at hand. So just to make clinical decisions. Yeah, it's you can't just sometimes you don't depend on genomics alone, but genomics is just trying to kind of let's say trying to improve the kind of the clinical decisions that we want to make. So it could be some other things. We don't need to look at the genetic aspect alone. We need to look at some other aspects that may uh, that may cause this hypersensitivity reaction. It may not be from the genetic point of view. Maybe some drugs that is used along with Abacavir or some other informations like that. Thank you all for turning in the questions. Yeah, I don't know about atenolol. So if Abacavir and atenolol can be used together, maybe the atenolol is trying to suppress the Abacavir, the reactions. I think that's one of the aspects that you need to come in as clinicians. You already know that this is what this patient is that's causing hypersensitivity reactions. So atenolol can then suppress these reactions. I think that's when to make the clinical decision. Thank you for bringing that. That's when you need to make some decision that this is what is going to work for uh, the patient. And again, the atenolol may still be having some other maybe some other reactions as well, some other adverse reactions. So that's why sometimes it's good to do genetic testing just to be sure if all these things are not going to cause a kind of inflammatory or some other adverse reactions. So that's a good question. If there's if you have maybe a variant or maybe yes, and you check through the database and you didn't see any information. So I just want to show you something. Via checking Google search alone is a kind of database on its own. Let me just pick this up. Let me pick this up. So we are checking Google, like Google search alone is a database on its own. Like you can do general search. So I'm sure it's going to direct you to that database that contains information about that. It's still going back to the same clinical variant database that we are talking about. Via Google search. So if you go to databases and you are not able to make some inference from that, that's because maybe no information has been reported about that, or be the information is still in literature and maybe a kind of validation maybe has not been be talked about this variant or some other informations that we talked about. So you just need to, like, sometimes you may not be able to find information from the databases. Maybe the variant, let's say the variant is novel, nothing has been reported about that before. So and this is going to be a research ongoing process. That means the research is still ongoing. You need to do some other research to really benchmark if this variant ID is associated with this condition. This is like from bench side to clinic, from clinic back to bench side. So that's how it's going to be. So that's why there should be a kind of association between researcher and the clinician. So if maybe a clinician have a ID reported and something like that has not been in, been in the database, so researcher can then make some findings about this ID. Is it associated with this, and can something like this be put into a cohort studies to just validate this? And that's how most of these informations are getting into databases. I believe I'm able to answer your questions. So that's one of the challenges why trying to work with uh, all these databases. Sometimes you may not be able to see all what you are looking out for. So it still goes down to going to research, trying to validate all your findings. So thank you all for joining today's session. I believe I've answered most of our questions. Do you have any other questions? So how many databases can we consult before drawing inference for the patient? Or is it just one database enough to get the necessary information relevant to the patient? So you need to consult different database. But again, it's not going to be possible for you to consult the available database. Informations are not in one place. If it is possible for all of this information to be in one place, I think trying to have a general purpose database that is going to work for our use case, I think that would be good. But you need to consult like maybe two, three databases that you see that is going to kind of make points to what uh, uh, you are trying to achieve. So you need to consult like multiple database, but this has to be maybe what you are depending on what has been the database that has been recognized in where you are working. Still boils down to the clinical settings. So the kind of database that they are using, how did the level of trust they have for these databases. So becoming a so how do we become a clinical bioinformatician? So this is the clinical bioinformatician is just like you need to work in, let's say, clinical settings. There are some people working in clinical settings still learning bioinformatics, but you just need to take some studies, maybe a master's or PhD program in normal bioinformatics. Then you start applying it to maybe in a clinical setting. You then move into a clinical setting, or you collaborate with those people in clinical settings and start carrying out research on clinical bioinformatics. So I think there is a Google document that has been attached to our mail. So if you have any question, you can just drop it in that Google document. So and we are going to reply to your question from there. I don't think we have any other questions.
Yeah, I think I think for now, um,
Any other question?
I can pick it up from here and walk us through some of the tools, like Daniel has rightly said. Please can you run through the step to find the right answer to the question you throw to us? Okay, Daniel, I think before you go, somebody wants you to do the tax you give them so that to be sure what they did was correct. Can you do that?
So yeah, no, I said Abacavir, right? What you just need to do is, this is pharmacogenomic database. This is the knowledge base. So what you just need to do is you type the name of Abacavir. So you just do it like general searching. So Abacavir, and you want to check some information. This is the structure of that drug. Like this is the structure of the drug, and you want to check some information about it. Just go to the annotation clinical annotation database. These are a lot of database linked to this pharmacogate, from clinical annotation, from drug label, so a lot of information linked to this. So this is level one. Level one is trying to show us the confidence level that we have for maybe this variant is discussing kind of is causing a patient to express a phenotype. So, and you can see from here, without trying to go further, you can see from here that HLB 5701, the variant, it's a variant from HLB, and the drug is Abacavir. Phenotype category is toxicity. So, and the phenotype is here is saying that drug hypersensitivity reactions is associated with HIV. You know, Abacavir is an HIV drug. So, and this, if the patient is expressing HLA-B 5701, so that patient is prone to develop hypersensitivity reaction. So that was what that means. So if you look at this, the level confidence for this level 3 is low. So this is another variant, and this is another gene that has been associated with Abacavir as well. So and you said that it's also toxicity and hypersensitivity reaction. This is just how to kind of make a quick decision that this, from your report, from after sequencing, you have HLA-B 57 variant from the analysis. So you can make a quick decision that this could be that what is causing the patient to develop hypersensitivity reaction. So and you can also check some maybe a kind of pathway, a lot of information that has been linked to this thing, the pathway related to this, and some other information like that. Literatures do a lot of reading about this. Information about the variant itself, variant that has been linked to Abacavir. A lot of readings trying to just make clinical decision from there. You can see from there that all these are still pointing down to the same thing, HLA-B50, HLA-B, except this. So these are just or some other variant that may predispose players to develop hypersensitivity reactions. So that's how to just go about that. Just just checking to the database, that making some decision from there. I believe I'm able to. All right.
I think that is a very nice presentation. Thank you for the good work. I want to believe that everyone can hear me clearly, loud and clear. Yeah, Ola Binton, Ola Body. Do you have a question? I see raising up your hand before I start my own next class again. Ola Binton, Ola Body, I see raising up your hand. Okay, Lorita Kumasi. I see you raising up your hand. You are yet to unmute yourself, so I cannot hear you. Kindly unmute yourself, Ma, so that we can hear what you are saying. I can only see your umbrella. Yeah, you are talking, but I cannot hear you. You have to unmute yourself, please. You are still here to unmute yourself on your device. You should be able. Daniel, please help you can help her unmute herself if it is possible. Okay, question has been answered. Mr. David or Dr. David Olutimileyin Oyeyipo. Can you ask a question, please? David Olutimileyin, sir. You have the floor. Can you ask a question before I start the next thing I need to do?
Okay. Thank you, sir. I think I was going to ask if we have access to the maybe lecture material, the entire class, so that we have something to maybe revisit to sharpen our understanding.
Yeah, for those who have paid for the certificate, by the time we are sending the certificate to them, we are sending the materials along to them, the slide and the link to the video of this class so that they can watch several times to enhance their knowledge about it. So we're definitely going to do that, sir.
Thank you, sir.
Yeah. Now, I will be talking about another thing entirely. Then I will navigate my part to a very interesting and a little bit complex. I use the word complex because I'll walk through some tools, some databases, just show us what it can be used for, ethical. Somebody is asking about ethical issue. I think when it comes to ethics, every profession has rules and have rules and regulations that guide their ethics. You know, this is just coming into African with laws and regulations that will be guiding the use of an individual in the community. I think that is only what I can say for now. Yeah, you cannot consult a single database and just conclude. You have to consult as many as possible to compare and contrast. So that is a good way to go about it. Now, I'm walking us through this part. Uh, let me start from where it stopped. This is metagenomics. Yeah, we have a tool. I'll be talking to us about it. He has talked about pharmacogenomics. That is what he just talked about now. Now we have drug interaction database. What it does, it allows you to know how your gene interact with drugs and how drugs and drugs interact together. So if you have two drugs that you want to give your patient and you are trying to look at how those drugs will interact in the system, this is one of the tools that we allow you. And this one actually is for research purpose. It should be not used for emergencies and medical. Yeah, that is one thing about it for emergencies and medical. We have side effect resources. This allow you to know the side effects of any drug you want to give to your patient. So if you have any drug, search for drug side effects. We have been talking about Abacavir or something like that. They are perfect. That's the structure. So look at the side effect. You can see the side effect of all the drugs. So because some of the time pharmaceutical industry will not give you all the side effects. I'm not saying that they are not good, but in the leaflet, they may not tell you all the side effects. Some of these information are gathered from patients in the clinic. So you can see here now we have malaise, myalgia, chills, cough, drug, nausea, headache, pa 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 pam pam pam. So as a pharmacist, you see the side effect. You see frequent on drug for side effect. We can talk about toxicogenomics to see you can analyze a drug to see the toxicity level that the drug really has in terms about the anatomy, the chemicals, the pathway, the exposures, the genes, everyone that has to see what even the drug even though you are designing, you are prescribing to your patient, not even relying alone on what a pharmaceutical company has really given out to you. That is that on that. For people working on cancer, they want to see the genomics of drug sensitivity in cancer, see how the drugs will actually, sorry, it's not going through. I thought it would be working. They are updating the server. I have used it on several occasions. So it happens like that some of the time. So that is what we have here on pharmacogenomics, because it talked about pharmacogenomics. So let's see what's wrong with my internet. Okay. Yeah, sorry, I'm back. So I'm talking about the gene prediction now and annotation. Like you sequence your human genome population, you have some genes, you cannot even know the function. Uh, if you go through GeneEd like this, it's going to show you how you put your gene sequence here, then get evidence here. From there, if you put it then, and it's for Homo sapien. So from there, you can know the function of that gene and the role that is playing. And that's why they were able to come up last time about BRCA2 gene, BRCA1 gene, that all these ones are involved in cancer, breast cancer. So these are the kind of tools that you can use to predict what is actually happening in human population. We have what we call gene expression. Gene expression allow you to know for that of a cancer that what is the stage at which your cancer is in a human population. After you have sequenced it, you have it. We have a lot of tools like this that after this class, each one of us needs to go for better or specialized training depending on the area of interest of individual to actually see that, oh, I'm interested in cancer biology, so I have to do this. I'm interested in antimicrobial resistant, I need to do this. So that is one of the things that we can actually use to help our clinical information to do. And even, let me be perhaps, uh, I have my way of being biased, like I said, that we have what we call gene regulation to see how genes are being regulated